I'm dropping things, yeah. Good morning. The Subcommittee on National Security, Department of State, and Related Programs will come to order. I want to particularly thank the ranking member, I know, who had a big ordeal to try to get here this morning, and she got here despite some difficulties in transportation. Let me start by welcoming all of you to our hearing today to assess the President's Emergency Plan for AIDS Relief, something that we all commonly refer to as PEPFAR. So let me first introduce our distinguished witnesses. Ambassador Mark Dybel is a professor in the Department of Medicine at Georgetown University Medical Center, where he serves as Chief Strategy Officer of the Center for Global Health Practice and Impact. He is also chair of the board of Purpose Africa. Thank you for being here. Ambassador Dybel played a key role, a lead role in the founding of PEPFAR, of the program, during the Bush administration, and served as the executive director of the Global Fund to Fight AIDS, Tuberculosis, and Malaria. Ms. Catherine Connor is the Vice President of Public Policy and Advocacy at the Elizabeth Glaser Pediatric AIDS Foundation, and has been with the organization for over 17 years. I am thrilled and honored to have both of you here. You both have a wealth of experience on this topic, and we are grateful for your testimony this morning. Again, thank you both for being here. I have long been a supporter of PEPFAR. Since it was launched in 2003, the program has saved over 26 million lives and prevented 7.8 million babies from being born with HIV. Those numbers are frankly remarkable. It's an incredible feat. Over 20 million people are now on life-saving treatment, and over 70 million people receive testing services in more than 50 countries. The PEPFAR program, through the generosity, the extreme generosity of the American people, really saved a generation of individuals. Much of the success, both in terms of impact and the decades of trust and continued support from Congress, is due to the unmatched level of accountability and transparency that President Bush and you, Ambassador, demanded from the very start and obtained from the very start. Excuse me. This is especially important for us, for appropriators. The data-driven approach that PEPFAR uses to justify budget allocations and the detailed reports that this committee receives clearly outline results achieved through the annual funding. Now, unfortunately, under the previous administration, the Biden administration, the PEPFAR program was not immune from misguided campaign to push controversial ideologies using taxpayer dollars. You've all heard me say this before. I warned in every hearing, in every markup, and frankly, in every engagement, that using funds to promote radical or partisan agendas will cost support for the program, and for all programs that I and many other Republicans have historically supported. But even more egregious, under the Biden administration's watch, the PEPFAR program violated the Helms Amendment and used taxpayer funds to pay for abortions. The very first time, for the very first time, as far as we know. Now, this is interesting. My staff was briefed on the violation literally hours before the Biden administration was out of the door. Even though, and this is key, even though the facts had been uncovered months prior. I was obviously outraged, to say the least, to learn of this shocking betrayal. Funds provided by Congress to save lives were instead used to end lives. Now, this was despite my efforts as chairman to push for more training and oversight with respect to enforcement of long-standing provisions in law to protect life. The incoming Trump administration announced a review of all foreign assistance programs on day one. And I want to be crystal clear. Given the circumstances and the gross mismanagement of the previous administration, a review is necessary. So I fully support this administration's doing a thorough scrub of PEPFAR programs as well as every other program. Frankly, it was sorely needed to ensure that bipartisan support can actually continue. Now, we understand the challenges that entails, and we understand that challenges remain in terms of ensuring programs that receive life-saving waivers get continued support and that owed payments are provided in a timely fashion. So here's a question. Where do we go from here? I trust that the administration is going to continue to work through these challenges in coordination with Congress. And I'm looking forward to continuing a fulsome discussion to understand implementation and the results of this thorough review. I want to, again, as I said before, I want to thank all of you here. I think all of us here today I think all of us here would agree that PEPFAR was never meant to go forever, right? I mean, is this something that is there for forever, in perpetuity? We're never going to have an ending to it? You know, these are things that need to be talked about, and we need to make decisions. And financially, we cannot continue spending at current rates for years to come. We all know that. Countries need to step up their own financial commitments and maintain a laser focus on achieving epidemic control. However, as we demand additional burden sharing and look to wind down, we also cannot afford to lose progress gained and create a bigger, more expensive problem for the future. I believe that a failure to maintain HIV patients on antiretroviral means the likelihood of increased drug resistance and potentially threatens achieving control, epidemic control. With new innovations coming online, notably American-made innovations, I believe that there are new opportunities to accelerate progress. As this committee begins the important work of crafting the fiscal year 2026 appropriation bill, this hearing will play an important role in shaping the recommendations ahead for us, for those of us putting these bills together. So I look forward to hearing from our witnesses about the successes, the challenges, and opportunities as we think about the future of the PEPFAR program. It is my assessment that PEPFAR has, and if implemented correctly, will continue to make America safer, stronger, and more prosperous. Again, I want to thank the witnesses for being here today. I will now turn to my Florida friend and colleague, my dear friend and colleague, the ranking member of the subcommittee, Ranking Member Frankel. You're recognized.
Thanks so much, and thank you to both our witnesses for being here. I'm sorry you've been shocked. You were shocked. Just let me tell you. All right.
I know that. I know that.
He knows.
Yes, I do.
Listen, this may be one meeting we're going to almost agree. Almost.
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 For us, that's pretty good.
But listen, now, just again, thank you for joining us today to discuss the future of PEPFAR, one of the most effective and most bipartisan global health achievements in American history. And I'll repeat a little bit only because we all get, I guess we all have to hear ourselves talking. What can I say? Since its launch under President George Bush, I'm going to give him credit. In 2003, PEPFAR has saved more than 26 million lives, supported HIV testing for over 71 million people, prevented 5.5 million babies from being born with HIV, and provided care to 7 million orphans and vulnerable children. It's trained over 330,000 healthcare workers and built a health systems that serve more than 50 countries across Asia, developing countries, across Africa, developing countries in Asia, Latin America, and the Caribbean. And I want to say something. I don't know if you remember this. We served in the state legislature together. But my first assignment, maybe you weren't there yet, my first assignment, I was made the chair of an HIV/AIDS task force. And that was in the late 80s, early 90s. And I just remember, because I spent so much time, it was and it still is obviously a horrible disease where people wasted away, most got infections, lung infections, and it was a death sentence. Without any question, it was a death sentence. Until, many years later, finally we do have a way with a cure, or not a cure, but to put it in remission, and people can actually live normal lives. But, it's not just about the numbers. This is about communities that went from despair to survival, and then opportunity. It's a kind of soft power that makes the world safer and makes America stronger and more prosperous. Before PEPFAR, HIV AIDS was wiping out entire generations across African countries and developing countries, and it decimated economies. It shattered families, created instability that threatened global security. But PEPFAR turned the tide. It showed the world what America can do when we lead with compassion, science, and smart investment. And to my chair, I agree with you of this. Every administration has a right and a duty to evaluate government programs. But what we've seen from the Trump administration, and this makes me very sad, especially with this program, is a reckless, dangerous sledgehammer approach that puts lives at risk and throws global partnerships into chaos. That's our diversion today. And from what we have heard, many PEPFAR programs have halted midstream. Waivers may be well-intended, but they're not working. We've heard that. Staff has been left unpaid. We heard that. Medicines are not reaching those who need it, and health systems that rely on consistent support are now scrambling in confusion. And I'm going to just briefly touch on this criticism that we're hearing that PEPFAR in 2024, an audit, and I'm glad there was an audit. It was an audit. It found that nurses in Mozambique had subcontracted through local partners, had performed 21 abortions over 3 years. That's what the audit showed. And even though abortion is legal in Mozambique, the U.S. law, we know, prohibits the use of foreign aid for abortion services. What was found was that the issue occurred because the nurses had not been trained on the restrictions under the Helms Amendment. But once it was identified, CDC immediately halted the funding and conducted a full review. It was $4,000. They collected $4,000 in salaries from the Mozambique government. It was an isolated incident and promptly addressed through improved training and accountability. And I have to emphasize, this represents a tiny, tiny fraction of the PEPFAR's $6.5 billion annual budget. And listen, nobody is perfect. Nobody, all right? I think they admitted the mistake, they repaid, let's move forward. But PEPFAR is not just a public health story. It builds resilient societies, keeps children in schools, it strengthens local economies. It reduces the risk of extremist recruitment because people are in a stable situation. It builds trust in America. Boy, do we need that. And I'll say it again, it makes our country stronger, safer, more prosperous. And what we do through PEPFAR has a direct impact on the health and safety of American people. The stronger the health systems are in other countries, the better we are all prepared to detect, detain, and respond to outbreaks. We're in this together. So now we're at a crossroads, and I hope this is where I think we are going to work very, very hard to find consensus, because if we allow PEPFAR to be splintered, this cost will not just be measured in dollars, it'll be measured in lives lost. Health systems weakened, trading partners diminished, society is destabilized, and trust in the United States eroded in the world. So today, I'm going to join you. I'm going to join you today as we move forward with bipartisan cooperation, which what got this program started in the first place, to ensure that this life-saving, globally respected program not only survives but continues to thrive. And as we move forward, we look for ways to strengthen PEPFAR's operations, make it more efficient, more sustainable, so it could, hopefully we're going to find a way to just stop this AIDS, well, it's not a pandemic anymore, but the AIDS disease, but also leave in place some sustainable health systems. So let's work on this together. That's where we agree, and I yield back.
Thank you to the distinguished ranking member. Now I will yield to the ranking member of the full Appropriations Committee, Ms. DeLauro, for her opening remarks.
Thank you so much, Mr. Chairman, and I want to thank both you and Ranking Member Frankel for your leadership on this subcommittee, and I'm really so very grateful to have the opportunity to raise awareness for the President's Emergency Plan for AIDS Relief, PEPFAR. I thank the Chairman for calling this hearing and for your support of this program. I want to say a thank you to our witnesses here this morning. Thank you for your testimony, but more importantly, I want to say thank you for your expertise, for your dedication, for your commitment to looking at trying to end the scourge of HIV and of moving over the years to address the issue that has rented so many people asunder. And we can't put a high enough premium on the issue of saving lives. So thank you so much. You've built up this program, Dr. Dybel, Ms. Connor, and we're so grateful to you. Over 2 decades, it's been said, but it bears repeating. PEPFAR has saved 26 million lives around the world. Think about it. 26 million is roughly the population of the chairman's home state of Florida. The 26 million people saved by PEPFAR are mothers, fathers, sons, daughters, teachers, nurses, farmers. And instead of facing death and despair, they are raising families, they're building their communities, and helping their home countries grow and to be able to develop. HIV/AIDS is not the death sentence it was just decades ago, and HIV prevention efforts are effective. Do not take it from me. The State Department's website says, and I quote, PEPFAR's life-saving work is enabled through the U.S. government's unwavering commitment to the program and the American people's compassion and generosity, as PEPFAR ensures every U.S. taxpayer dollar is optimally focused for impact, end quote. It was PEPFAR's platform that was utilized to help countries respond to COVID, and which is being used today to fight tuberculosis and more. Through Democratic and Republican administrations and Democratic and Republican Congresses, PEPFAR has held widespread bipartisan support. But PEPFAR is in dire straits. In working to abolish foreign assistance, Elon Musk and President Trump froze funding for PEPFAR, halting testing and treatment for HIV/AIDS patients around the world. And after funding abruptly stopped, the State Department determined that portions of the PEPFAR program met the criteria for, quote, life-saving and could be restarted. But PEPFAR is not fully functioning. Funding is not flowing. Medicine is not being distributed to those who need it. Among many short-sighted and ill-informed actions, this funding freeze was made under the guise of eliminating waste, fraud, and abuse. I'm all for finding and eliminating waste, fraud, and abuse, something Inspectors General Richardson and Martin at State and USAID respectively were tasked with doing before they were illegally purged in the dead of night. But millions of lives are not a waste. In fact, Musk and President Trump have created even more waste and made government less efficient. While portions of the PEPFAR program were allowed to continue, the key implementing partner agencies, USAID and CDC, are being destroyed, obstructing the path for resources to reach recipients. Public health abroad affects public health at home. Economic stagnation abroad affects our economy here in the United States, and when people are needlessly getting sick and dying overseas, it means weaker partners, diplomatically, militarily, and economically for Americans. For 20 years, we have invested in this program that saves lives, but that also strengthens our diplomatic relationships. But overnight, this administration has allowed decades of work to backslide and undermined our nation's greatest public health diplomacy effort. This does not put America first. When we retreat from the world diplomatically and through our assistance to vulnerable people, America will be alone. We will be without allies in a less stable world, without the support of the international community. And you know who will come out ahead? China, Russia, Iran. This chaos does not make America stronger, safer, or more prosperous. This administration is putting billionaire profits and our adversaries first. Americans and sick and vulnerable people around the world will be much worse off for it. This subcommittee, the full Appropriations Committee, and the Congress must commit to reasserting its power of the purse. Article 1 of the Constitution plainly states that government spending must and can be only a consequence of appropriations in law. We are not writing directives here, we are writing laws. I am hopeful that we will come together and fully fund PEPFAR and its implementing partners. We cannot let the fate of PEPFAR or any other critical program funded through acts of Congress rest on the whims of Elon Musk and Russ Vought. They must follow the law. Thank you, and I yield back.
Thank you very much. Ambassador, your full written statement will be placed in the record. Please feel free to summarize your testimony. Thank you for being here. Now you're recognized.
Mr. Chairman, Ranking Member Frankel, Ranking Member DeLauro, and distinguished members of the subcommittee. First of all, please accept my deep thanks for your bipartisan support of PEPFAR and the Global Fund to fight AIDS, TB, and malaria, despite decreases in your envelope over time. Your investments on behalf of the American people have made the country safer, stronger, and more prosperous. The details of the results have been provided and are in the written statement, so I'll forego them. But I think it is worth noting that PEPFAR has been called, and I think rightly so, the most successful global health program in history and the best policy decision of any president in 3 generations. However, as the chair mentioned, PEPFAR and the Global Fund cannot and should not be forever. And I'd like to focus on that for the time I have remaining. The capacity that's been built provides a foundation for fully country-led and owned programs, and also provides a foundation for detecting and responding to outbreaks before they become pandemics. It's also worth noting that domestic sources for HIV, domestic sources, not external, accounted for 59% of all HIV-related spending in 2023, but much more remains to be done. There has been substantial work to prepare for transitions, which is what we should be working towards, transitions from external funding to local funding and implementation. But now is the time to execute a comprehensive plan with clear, annual, transparent benchmarks, including, starting this year, reductions and redirections on funding. Countries are in different stages on their journey to self-reliance. In my view, there are a number of countries who could rapidly have full transitions, rapidly. There are 3 to 4 dozen additional countries, many with very large PEPFAR and Global Fund allocations, who could successfully transition within a few years, including annual resources reductions during that time. Others will take longer, some much longer, but they can and should begin now. PEPFAR and the Global Fund must function as a team because we have resources in both, and they both function in most countries. Working with heads of state, ministries of finance, health, economic planning, as well as sub-national entities such as governors and counties where appropriate, to develop formal transition compacts with clear timelines. It is essential that the faith and community-based organizations fully engage. They are likely to bear the brunt of rapid reductions because many governments do not have mechanisms to fund faith and community-based organizations, but those mechanisms can be built over time. The strong data systems that have been developed and that have been mentioned have to remain active to help countries maximize impact. They are used to identify how to have greatest impact, and for visibility into externally financed programs to ensure that vital services don't fall through the cracks. And again, those are most likely to be faith and community-based organizations. Those systems are also indispensable for your ongoing oversight and the administration's ongoing oversight of the program. The private sector must be at the table from the outset. Too often we pay lip service to private sector engagement. There are opportunities for American investors and companies to reap rewards now and for Asian, African, and Latin American investors and companies to grow their economies to create markets for our goods and services. And in fact, PEPFAR has proven that it increases the gross domestic product of countries in which it operates. There are also, as the chair mentioned, new technologies, American-derived technologies, and American companies that are producing products that could help us end the AIDS epidemic that would be important to provide not only in this country but globally. I can assure you there are partners from every sector, some of whom are already moving to work to develop and execute successful transitions in the countries in which we operate. While it's important that every country transition from external funding for HIV and health services, it is equally important that they transition to become stronger economic, diplomatic, and national security partners of the United States for the long term. When I was U.S. Global AIDS Coordinator, I was fortunate to visit Axum, Ethiopia, believed to be the birthplace of Christianity in Africa. At dawn, when the mist is over the town, it looked as it might have centuries ago, with local people and donkey-drawn wagons, spires of churches peeking through the haze, bells ringing to call all to prayers and to market. I visited the town clinic. The director of that clinic also was an elder and leader in the community. I was cranky that morning, and he kept referring to PEPFAR. I asked him what PEPFAR meant. His answer knocked me over. PEPFAR means the American people care about us. PEPFAR means the American people care about us. As this committee knows too well, the United States is locked in a global struggle to still be seen as a beacon on the hill. While we must lead, we must have allies, including in Africa, where democracy is threatened. We have lost ground as the #1 trading partner, and the opportunity for the future is so vast. Clearly, PEPFAR and the Global Fund alone are not sufficient. But after nearly a quarter century of supporting Africans at all levels, the wisdom of the words from Axum ring clearer than ever. People around the world know what we stand for when we stand with them. The choice is clear. Do we have a well-planned, structured, successful transition that helps make America safer, stronger, and more prosperous? Or do we retreat too quickly and chaotically, squandering some of America's greatest achievements, risking the lives of millions in the near term, a resurgence of drug-resistant virus and losing control of the pandemic over time, and ceding the field to competitors and adversaries? The choice is ours to make. Thank you for your time, and I look forward to your questions.
Thank you, Ambassador. Ms. Connor, your full written statement will be in the record, and obviously feel free to summarize your testimony. You have the floor.
Thank you, Chairman. Good morning, Chairman Boyart, Ranking Member Frankel, Ranking Member DeLauro, and members of the subcommittee. Thank you for the opportunity to speak with you today in support of PEPFAR and the local and global partners that make this life-saving program possible. My name is Catherine Connor. I'm the Vice President of Public Policy and Advocacy at the Elizabeth Glaser Pediatric AIDS Foundation, or EGPAF. At EGPAF, we're in the front lines of the fight to end AIDS and HIV. Our organization focuses on research, advocacy, and helping governments and communities respond to this ongoing health crisis. I'm deeply honored to be part of this mission-driven work, and I'm incredibly proud of PEPFAR's transformative role in driving us closer to an AIDS-free generation. Today, I'm asking you not only to protect funding needed to control the AIDS epidemic, but urging you to be an active champion for PEPFAR's future. The success of this program and the lives it continues to touch depends on your leadership. Our organization began out of a mother's love and heartbreak. Elizabeth Glaser lost her daughter, Ariel, to AIDS and was fighting to save her son, Jake. She turned her grief into action and founded EGPAF to push for treatments and research to give children with HIV a chance at life. In the late 1990s, our board committed to taking that mission global. EGPAF believed that what worked for pregnant women and children here in the United States could work for women and children everywhere. And then PEPFAR was created. PEPFAR allowed us to scale up our work in ways we could not imagine. Over the last 22 years, EGPAF has partnered with PEPFAR on HIV service delivery in more than 20 countries. We've worked alongside communities and governments to make sure families get the services they need not just to survive, but thrive. Last year alone, EGPAF helped test over 4.5 million people, including 750,000 pregnant women. We supported treatment for 1.2 million people. We worked closely with PEPFAR, local governments, and other partners to keep evolving, to share innovations, and build the best models of care. Thanks to U.S. leadership through PEPFAR and the Global Fund, millions of infections in children have been averted. Since 2000, new HIV infections in children are down by 75%, and AIDS-related deaths in children have dropped by 43% just since 2015. But progress is fragile, and right now, it's at serious risk. Today, nearly half of all children living with HIV still do not have access to treatment, and without intervention, peak mortality occurs between 8 to 12 weeks of life. Only 1 in 5 children born with HIV will live to see their 5th birthday without treatment. Today, I'm deeply concerned. The future of PEPFAR is uncertain, and that uncertainty is already causing devastating harm. 2 of our programs in Eswatini and Lesotho that had been granted life-saving waivers have now been terminated. Together, those programs were supporting around 200,000 people on HIV treatment, including thousands of pregnant women and children. These programs did everything from bringing medicines closer to the communities, supporting HIV testing counselors, training and mentoring nurses, providing cervical cancer screenings, and offering specialized support for pregnant and breastfeeding women and children. National governments are stepping up where they can, but frankly, the emerging programmatic gaps are extensive and threaten to overwhelm health systems unprepared for such abrupt funding shifts. In many of these communities, people are scared. They're facing an unknown future, unsure whether their treatment and care that they depend on today will still be there for them tomorrow. What makes this especially heartbreaking is that Lesotho and Eswatini are success stories, leaders in ending HIV as a public health threat. Now it feels like the rug's been pulled out from under them. Across AGPAF-supported programs, we are seeing troubling trends. Up to 50% of our sites are facing serious service disruptions, from viral load testing to early infant diagnosis, from CD4 counts to TB screening. Pediatric ARV stocks are dangerously low, and a significant amount of programming for orphans and vulnerable children has been cut. And these aren't just numbers, these are essential services. And when they break down, it directly affects whether people, especially children, live or die. PEPFAR's strength comes from a collaborative structure that emphasizes results, technical expertise, and strategic partnerships. This is also at risk. For example, as of last week, my understanding is that PEPFAR has lost all of its staff with specialized knowledge in pediatric and maternal HIV. That's deeply disturbing. This program started because Democrats and Republicans came together to save lives. Since then, as noted by the chair, it's saved over 26 million of them. But its impact goes beyond HIV. The U.S. is safer and stronger, more prosperous because PEPFAR has helped countries manage outbreaks like Ebola and Marburg and reduce drug-resistant TB. It strengthened public health systems, bolstered emerging economies, and improved how the U.S. is seen around the world. So we need that bipartisan leadership again. I ask you today to be an active participant in PEPFAR's future through the appropriations process, because now is not the time to step back. Thank you, and I look forward to your questions.
Thank you very much. Let me start with a couple questions. I'm going to be pretty flexible on the time, but I'd ask everybody, as always, to try to keep an eye on the clock. We know the statistics. They are, frankly, very impressive. I'm not going to repeat those, but we've heard from you all, and all of us know that. And this subcommittee, on both sides of the aisle, has supported PEPFAR for many, many years. But as I mentioned in my opening statement, I think we all need to agree that we have to look at what are the next steps. Are we going to fund this forever, in perpetuity? Is there going to be no ending? How can we hand these programs back to the countries and to the private sector and other donors, if necessary? And while we talk about, and I think rightfully so, the really impressive accomplishments, historic accomplishments, let me mention the price tag for that investment. So far, it's about $110 billion since 2003. That's a heck of a lot of money. Even for federal standards, that's a lot of money. And we all have talked about, and you heard it again this morning, about, well, how this also helps us with partnerships around the world, and it helps countries, be closer to us. But I think the American taxpayer looks at, for example, South Africa. Let me just throw one example out there. This is a country that obviously, we have a strong presence. PEPFAR has a strong presence. But But look what the government is doing. They're doing joint naval exercises with Russia. They're prosecuting Israel at the International Court of Justice, and a number of other actions that are working against U.S. national security interests. So I think it's fair to ask these questions, which is it working? Can we do better? And again, as I mentioned before, for how long? That's not being heartless or callous. That is standing up for the American taxpayer, and I would argue for the national security interests of the United States as well. So I'll start with you, Mr. Ambassador. You mentioned this in your opening statements, but what are some recommendations for next steps? Could you please expand on your opening remarks in terms of shifting responsibilities back to some of these governments and the private sector? And what's the best way, potentially, to go about that while keeping our gains, but also securing the national security interests of the United States and not continue to do this forever? So I'll yield to you.
Thank you, Mr. Chairman. And I actually fully agree with all of your comments. And as I mentioned in my open statement, and I'm really focused on it, it is very possible to begin a transition process. And South Africa is one of them. I mean, South Africa actually probably within a year or 18 months with planning could fully transition without losing any lives, but also bringing our private sector in. And there are actually some private sector people here who would be very active there. You asked the best way to do it, and the best way to do it is to work with tangible, with accountable benchmarks for transition in countries based on where they are from a socioeconomic standpoint, and report to you on that transition with reductions on an annual basis in the amount of money, eventually getting down to nothing. But at the same time, work closely with the private sector. And here, as I mentioned, we do not do this well. We have organs of the U.S. government, the Development Finance Corporation, the USDTA, the Millennium Challenge Corporation, but they're off to the side. If we bring them all together and work with our private sector and with the private sector in countries, and I can tell you in South Africa, for example, I work with high net worth individuals who invest in the health sector. They will come in and work with us and are hungry to work with us. So we can transition, we can have plans, we can get, within 2 years, the vast majority of countries transitioning in a clear way, in a sustainable way, without an abrupt, chaotic decline that will maintain the gains, increase the benefits, and also give us maintain the diplomatic and economic opportunity. The alternative is chaotic, chaos, retreat, and loss of all the benefits that have been gained. So it's not, I completely agree with you, it's a matter of time. It is a matter of time planning and benchmarks, and those plans have to be presented to you with clear, sustainable approaches to transition.
Thank you. The ranking member.
Thank you. You know, I realize now, I have 2 grandchildren, and I'm starting to think like I'm talking to them. And there's a nursery rhyme, but I don't think they even know what I'm talking about. But I say it's called Humpty Dumpty. Humpty Dumpty sat on a wall. Humpty Dumpty had a great fall. All the king's men couldn't put Humpty together again. And this is what I'm thinking about right now when I'm thinking about foreign assistance. Because, first of all, thank you both. You're both terrific, and what you've done for humanity is amazing. What I'm worried about, I do like the concept that we can work together to let countries where they can have a sustainable health system, that they go on their way, that we get the private sector more involved. Very good ideas, I think. What I'm worried about, and I just want to know is, what has happened in these last 30 days or so? There was supposed to be a waiver, as I understand it, a waiver to allow, I thought, to let PEPFAR continue its work. And I know nobody likes to criticize this administration. Well, not nobody, me, I like to, but could you just tell me factually, what's happened on the ground in terms of, are these, are you talking to me?
Not just say what's on and what's off.
Yeah, what's on and what's off. because we've heard people haven't been paid, that some of the programs are shut down, that people were fired, they're not implementing. Can you just tell us where we are? Because, as I said, I'm worried that it's going to be so cracked up, sledgehammered up, that we're not going to be able to go forward like you're suggesting. Who wants to answer that? You both? Okay.
Happy to do so, Ranking Member. And I can speak to our experience with it. I do think this has been a challenging period of time. Most of us who work in the HIV community, and as we've talked about, every administration comes in with its own priorities and wants to review the program, and that was expected. I think the way that the review has been handled has been sort of challenging on the implementation side. It did start, obviously, with the stop work orders for all of foreign assistance, and that included PEPFAR at the time. And then there was this opportunity for the waivers to take hold, and many of our projects did receive life-saving waivers. There was a small, again, that did shrink the scope of work. There were certain activities that were not considered life-saving, like OVC and some preventive opportunities, but mostly treatment and care were considered life-saving. But those waivers were not implemented automatically. There was a process that had to go through once the waivers were announced. Then the implementing agencies had to apply those waivers to each individual project. So, because you can imagine with all the PEPFAR projects, looking at each project, determining which part is life-saving, which part is not, revising work plans and revising budgets, and even then we still had to get permission to restart those programs. So we have been able to restart work in many places. But then what happened is that some terminations occurred. So even programs that did receive life-saving waivers were then terminated. We had 3 countries actually with terminated care and treatment programs. One was then unterminated. So again, as you can see, it's been very hard to sort of follow, like, what should we be doing? Even when we get permission to work, it's been hard to tell and work with the mission and with the national government. Are we ready to move forward? Can we move forward? Or is something else going to occur? So I think from our standpoint, I think one of the major things that we really want to see happen sooner than later is to really sit down and look at the capacity that's remaining. Is that once we get through this review period, what projects are standing, where can we continue work, and also all that work interconnects. I had a colleague tell me yesterday, she's like, the problem is by looking at all these projects individually, you miss the interconnectivity. So a project like ours, where we're working with pregnant women, we're able to get them tested, we're able to get them on ARVs, we help them through labor and delivery, but then the infant test happens, and that test has to be transported to a central lab to be processed. And that's where the transportation, the organization was doing that transportation is no longer there. And so that link in the chain, other parts of the chain are working, but once leak falls apart, it all starts to fall apart. And so I think until we get a sense of where that capacity is, where is the country able to fill gaps, where do we need to course correct after we look at what's happening in the field, I think we'll be able to move forward from there.
All right, well, that was very diplomatic of you. Thank you for your good work. My understanding is that the PEPFAR is not, as it was established, it was not just for emergency, it was also for prevention. So, because I think, and Mr. Dybel, maybe you would know this, there's something like 20 million people who are on medicine that keeps them alive and well. My understanding, that's been cut off. Is that is the part of the program that's not in effect right now? Did I hear correctly? Either of you can answer the
I
question.
can answer that. You can join in as well, Ambassador. So that was not considered, the work on prevention was not considered part of life-saving work.
All right, so in other words, you are going to get an A for being diplomatic, but in other words, there are 20 million people plus out there who their medication has stopped. No, you say no, it hasn't. Go ahead. Mr. Dybel, you can speak.
I also have, in the world is a strange place. I'm a PEPFAR implementer as well in Eswatini, and we are still delivering antiretroviral therapy. And the supply chain system that delivers it has been given a green light to begin the procurement again. But it is unclear where things are going, and that's the problem. And lack of clarity is a problem for producers. It's a problem for people in the country. And while some programs are continuing, some have stopped. The prevention programs are another story, which we'd be happy to talk about, because that is very important. PEPFAR was a prevention, care, and treatment. And in the end, if we don't prevent new infections,
Yes.
this epidemic is going to get out of control again, then all the gains of the past will be lost.
And the prevention also has to do with the transmission. I'm going to just finish this up. With mother to baby. And that, my understanding that that's been in demise.
The life-saving waivers were supposed to include those. We have had difficulty getting them up and started again. And again, mostly because of how the services are provided. Like if an HIV positive woman comes in and can't get tested, we can't even start the process. So if you take HIV testing away, if you take HIV counseling away, if you take away prevention counseling,
Right.
we can't get to the core ARV services. So even where ARVs still exist and can be given out, we may not be able to get to that part of the care continuum because of all the other blockages that we're seeing.
I think I understand what you're saying. Prevention, people are just going to get sicker and sicker unless, and we're talking about millions and millions of people, unless we have some kind of intervention. I hope that somehow we can send a message to, to the administration. We're with trying to become more efficient, accountable, transition to countries being able to where they can take over these operations, but they have to have something to take over. And just letting millions of people get more sick is just going to make things worse. Thank you for your
All right.
patience. I
No,
yield back.
absolutely.
I yield
I'm not going to cut off the ranking member. Mr. Laura, the full committee ranking member, I don't know what your time constraints are. Do we go, you're okay to go back and forth, or do, because I can recognize you now if you'd like.
Do you want to have something? Go ahead.
All right, I just want to make sure that, I know that your time is, I know that you've got a lot of other subcommittees that you like to attend. All right. To the Vice Chairman of the subcommittee, you're recognized, sir.
Thank you, Mr. Chair. To both of you, thanks for being with us this morning. One of the allegations that I've heard over the PEPFAR program is that taxpayer dollars had been somehow used to fund abortions. And I can't help but think, how can this committee appropriate funds for such a worthy cause, it appears, and yet those funds be so egregiously misused? How does that happen, and how does this committee ensure that with any other decision that we make, the funds are actually used for the sole purpose that they're intended?
Mr. Vice Chairman, you raise a hugely important question, and let me just say from the outset, and I think anyone implementing would agree, it is completely unacceptable when the U.S. law is violated in any way, but in particular on the Helms Amendment, because that's such an important part and has been a benchmark of foreign development, and particularly HIV programs. There was in Mozambique, as the ranking member mentioned, a group of nurses that were not trained in the Helms Amendment and were active in abortion care. Their salary was paid for by PEPFAR, which you could say then funded the abortion, but it doesn't matter. I mean, I think we're getting into details. It never should have happened.
Excuse me,
Yeah.
with all due respect, we need to get into the details
Yeah.
here. We need to understand how the United States sends money someplace else and then it gets used for a purpose totally different than what it was intended. I'm okay to hear the details.
Yeah. So as I understand the details, nurse funding went to the government for nurses to provide care, including HIV care, but they do other things as well, and that's an important piece of what happens is what PEPFAR has done is funded a health system which allows for pandemic response and many other things. So those nurses were being funded in order to provide HIV care, but then they also performed abortions. And that is unacceptable because no one funded by the U.S. government should engage in those types of activity. And as was mentioned by the ranking member, they had not been trained in the Helms Amendment and weren't aware of it. And so now, and these have to be put in place, and this is a problem with cutting money too quickly. It's difficult to have oversight then, especially if you don't have the systems to do it, is training of everyone who receives any money from the U.S. government in the Helms Amendment and in the U.S. government policies and practices so that they understand what they are, that they actually sign and attest to that they are aware of those policies and practices, and that very importantly, that there be reviews, systematic reviews, and as the ranking member mentioned, this did happen, but it didn't happen until after, that there be regular reviews and everyone be aware that those reviews are happening to deter any action against
Right,
the law.
that is helpful. One of the key screens for this committee now is to make sure any funds that we spend abroad are in the best interest of our national security. Can you tell me how funds for PEPFAR and preventing AIDS abroad is in the United States' national security interests?
Perhaps I can speak to that as a former ambassador and level of Assistant Secretary of State. I can tell you, let me give you an example. When I first went to Namibia, I met with the president. This was early in the days of PEPFAR. And the president said to me, you know, we hate the United States because you were on the wrong side of apartheid. But now we love the United States because you're the only one here supporting us in something that's going to destroy our country. So the soft power the ranking member mentioned is hugely important because the United States actually, if you go back, it's hard to do a negative. But what we expected to happen, what the US intelligence community expected to happen, was literally Africa falling apart because there were countries where a third, more than a third of the adult population was infected. There was a district in Botswana I visited, 75% of pregnant women were infected with HIV. They were all going to die, their kids were all going to die. There were entire villages run by orphans. The African continent could not put a peacekeeping force together because their soldiers were all infected with HIV. And because HIV hits people in their reproductive age and productive age, it was factory workers and machine workers. Ford Motor Company in South Africa was among the first providing antiretroviral therapy because it was going to destroy their ability to produce cars. So on a diplomatic front, on a stability front, and on a soft power front, it is in our interest. The other way it's in our interest, and this has been shown, is Africa is the fastest growing. By the 2030s, Africa will have more people than India or China. And it is a young population. It is also among the fastest growing economies in the world. And it is the economy of the future. Virtually everyone predicts that. The CEO of Walmart told me that. Africa is our trading partner for the future. It's where we will make money, where our companies can make money and invest. There's a company sitting right behind us that produces new technologies that could end the AIDS epidemic. So on a diplomatic dividend front, on a future economic growth and development front, and economic opportunity, and on a national security front, both on the diplomatic and economic and stability side. This is in our national interest, which is why we did it. The first time the UN Security Council held a meeting on an infectious disease was HIV for all the reasons I mentioned. What was averted, a negative's hard to measure. This is in our national security. I can also be very clear, because I spend a lot of time in Africa, we are losing ground rapidly because of recent events and because of the fact that China and Russia are all over Africa right now, all over Africa. And we have lost our status as the #1 trading partner in Africa. And there are a lot of resources and minerals and that future economic opportunity. And if we cede that field to our adversaries, it will not be a pretty picture because it's a big part of the world.
Thank you.
Thank you. Ranking member of the full committee, thank you.
Thank you very, very much. And thank you, Ambassador Dybel, for really answering the question about national security. Thank God for George Bush, who understood the need and the fact that this was really in the best interest of the United States to be engaged in the PEPFAR program. And we have, and after him, countless others, Democrats and Republicans, have understood the need and the necessity for not, one can say, if you can't understand the humanity of all of this, then understand what it means in terms of our national security and the stability of these economies in order for us to be able to participate in a world economy, though that may be under threat as well these days. Let me just, PEPFAR works, yes? PEPFAR works, okay? 20 years, you had one incident, not pushing it under the rug, but you've talked about it, you explained it. The other issue is here, it's my understanding, that these nurses were not trained with the Helms Amendment, et cetera, and there was a revision of the plan in order to be able to do that, but now we've got nothing but chaos. So whether or not people are being trained or not trained, et cetera, it's up for grabs. I think I want to ask my question, but I also want to just say this. I believe we're looking at a pattern here, because the domestic HIV programs are under attack. I spent a lot of years on the Appropriations Committee with the domestic HIV program with the epidemic of trying to rid us of that, and very close to doing it, except the money has been snatched back. So this is part of a pattern, which I quite frankly don't understand how it comes out in terms of the mission of saving lives, yes, and of dealing with U.S. national security. As of September 2024, PEPFAR was supporting the antiretroviral therapy ART for more than 20 million people in 55 countries, that including 566 children living with HIV. As a result, the use of ART led to 95%, 89% of children being virally suppressed. As a result of the funding cuts, UNAID has warned that this will lead to more than 6 million excess deaths and an additional 2,000 new HIV infections each day, or 730,000 a year over the next 4 years. ART suppresses the viral load to a level that makes HIV undetectable, prevents transmission. What is happening and will happen to more than the 20 million if they have to stop using ART? What do you expect to happen to transmission rates?
I'll jump in here. Thank you, Ranking Member. I appreciate your comments, and I think it bears repeating that I think in some ways our progress has masked the root of the problem, which is that HIV is an uncurable, infectious, and fatal disease. And because we've done such a good job in trying to control it, we forget the devastation that it can bring. And I think both the subcommittee members as well as Ambassador Dybel have done a good job talking about that. And the disruptions we are seeing have the potential to see some resurgence. You mentioned all the people that are on treatment. Right now, the ARV stocks are low. There was a really good market analysis done by CHI that really looked at the supplies that are coming in. And right now, there may be no ARV stockouts, but our own organization has looked, and there's not a single country we work in that has more than 2 to 3 month supplies of pediatric ARVs right now. And children that experience treatment disruption die much faster than adults who have treatment disruption. So I do think we can expect to see increased mortality, increased infection rates, and a lot of despair if things aren't corrected.
And just a couple of other things here. So if the administration fails to continue investing in a comprehensive program, do we then figure that we have squandered the billions we have provided over the last 20 years? Have we thrown that money away, given what you have just said about what happens for the future? Just an adjunct question to this, if I might. I find that PEPFAR works with other agencies. You were looking at USAID, CDC, and that in essence helps to make it work, right? So now, if you're focused on maybe not investing in PEPFAR, and then you are decimating or dismantling USAID, and you are decimating CDC at the moment, which we are watching in real time here, How does that all play into what your mission is? And again, the squandering of billions of dollars. As I say, if you can't get people on the humanity of it, think about the money that we have spent here. You know, I choose humanity, but also efficiency. But let's talk about efficiency and the use of dollars and what those dollars have created, and what happens when these agencies that you rely on crash and burn, and where do you go from there?
And I'm going to ask you to try to get, it's an important question, but try to get to it concisely.
That was a question, Mr. Chairman, and I'm sorry for the.
And it's an interesting compliment to what Ambassador Dybel was talking about planning and looking at capacities and how we transition work. You know, right now, we've talked a lot already in this hearing about the disruptions we've seen at the country level. We've talked a lot about where countries can lean in and do more, where private sector can do more. But we're not just disrupting the technical capacity that's in the field. We are disrupting the technical capacity at PEPFAR and the ability for these agencies and PEPFAR leadership to create a strategy, to make a plan. You know, again, I keep focusing on the area of my organization. You know, we've heard over and over again from the Trump administration officials that they want the focus of PEPFAR to be on eliminating mother-to-child transmission of HIV. But we're seeing the services in country being disrupted, and we're seeing the technical expertise that could help us create a strategy to do just that be diminished as well. So this is why I think it's going to be very important for this committee and its oversight function, but as well as conversations with the administration to look at this capacity. Where have we diminished our capacity so much that we really have to rethink? We need to lean back in, because right now it is hard to see a way forward. And I think that, as Ambassador Dybel mentioned, the confusion about where we're supposed to go, what are we supposed to do, how are we supposed to do this work if we don't have the structure at the top to help direct our work, we don't have the structure at the country level to do the work and do it in a way that we can transition and sustain it over a long period of time.
Thank you. And
Thank you very
thank the
much.
ranking member.
Thank you.
Mr. Molinar, who also is the chairman of the bipartisan China Task Force. So thanks for being here, sir. You're recognized.
Thank you, Mr. Chairman. Thank you to our witnesses today. And, you know, Ambassador Dybel, I want to follow up with you on some of the comments you've made about, you know, China's work in Africa. You know, we know about the Chinese Belt and Road Initiative. They also have the Health Silk Road. You know, it seems that their purpose is really to expand their influence and control and expand the reach of their surveillance state and use it for both, you know, economic as well as military purposes. I wonder if you could talk a little bit about some of the efforts they're making in Africa, because I agree with you. I think the question I hear from ambassadors from African countries is, you know, we'd rather do business with the United States, but where is the United States? And I think it's important that we have a strategy on that, but I wonder if you could comment on that situation.
Yes, thank you very much, and thank you for the work your committee does, because I think it's hugely important. I was talking with Mary and Chris Smith, of course, a part of that committee as well, and I hope the Senate does one as well. So China is all over Africa, and I can tell you they have gone in and started to meet with governments to say, well, the U.S. is pulling out here, so what can we do to support you? And that is a massive risk to us for the long term. You know, the diplomatic dividend to us of PEPFAR has been enormous because they see their lives saved. And this is down to the community level. I go back to that person in Axum. PEPFAR means the American people care about us. Shocking state. Down to villages. If we lose that, we lose a great deal, and we lose a great deal for the future because of the mineral wealth that is there, which are essential for all the things that we're doing, as you know better than I do. But we also lose the military capacity there. And the Department of Defense has been a key part of PEPFAR. We forget about that. But in the beginning, the Department of Defense was as important as any other agency because the militaries were so devastated by HIV. We spent a lot of our time supporting the militaries. And if it comes back, they're going to be the most impacted as well. But related to China, they also have grown their pharmaceutical industry. That was actually just for China. They now are trying to export their pharmaceuticals. They're pretty good at copying pharmaceuticals, and they're even inventing their own. They're Going ahead on AI, which is a massive area for the United States, as you know as well. Who's going to win the AI war? Well, if you're, first of all, you have a lot of the materials in Africa that you need to make those chips for AI, but then you also have to have places to do AI and have a genetic pool, which Africa has a massive genetic pool that is untapped. So on every level, we are at risk of ceding ground to China. Now, is PEPFAR and the Global Fund enough? No. But there are other parts of our government that could be. And here's where the planning for sustainability is so important. The planning for sustainability should not just be around HIV, TB, and malaria. That is hugely important because that will protect a lot of lives. It'll protect the future. It won't squander, as the ranking member said, our investments to date. But it has to involve a broader picture, which includes our private sector, which includes our military, which includes and we can do that if we integrate how we operate.
And I would just like to also mention, you know, when I read PEPFAR, President's Emergency Plan for AIDS Relief, I think of a plan for an emergency being something that needs to be modified, updated, and as you point out, you know, looking at how some countries can transition. You mentioned South Africa. I'm sure there's other countries in that mix, but I don't know how often that plan is updated according to, you know, new conditions on the ground, new situations, because it appears like it's an ongoing government program, but that's very different than a plan that is strategic, updated regularly, and as you point out, benchmarks and evaluation. But I wonder if you could, is that something that can be redrafted in a new era?
Yes, and that's exactly what needs to be done. No question about it. That the transition needs to be. We have done it in some places. As I mentioned, 59% of all HIV funding now comes from domestic sources, and that's really increased over time. But it's nowhere near enough, and but we don't have clear plans, and that's what I think this committee and the administration can require. And PEPFAR actually has been working on one, but it has to be with the Global Fund because we also have sources there. But we do need to shift to a clear plan with compacts with every country, and there are some that I mentioned. There are about 3 dozen that could transition in the next couple of years, literally the next couple of years. So you could see what we need to do in that reduction in our investment. That $100 billion could go to something very low. But if you do it in a structured, clear way with those benchmarks, and you ask for that plan, and the administration demand that plan, and report to you regularly on that plan, it can be done, and we can have a success. So instead of a rapid retreat that will be a total failure for us on every front and threaten our national security, we can actually turn it to a success and have that transition.
30 seconds more. Just one, I have to leave for another meeting, but one thing that strikes me is the public health community has lost trust over the years. And one of the reasons I think, you know, this issue of PEPFAR, this issue of abortion is so impactful, and I've heard it today, this term abortion care. When someone says that as a healthcare professional, it immediately diminishes their credibility in the minds of many Americans. Because when they hear something like that, they're interpreting it in a way that says, you're concerned about children dying of AIDS. Many others are concerned about children dying from abortion. And there's no difference in terms of saving an innocent human life. And so I would just say, as you speak to the PEPFAR community, to be very clear about the importance of that, because, you know, all of us should be in the business of wanting to save human lives. And I think in the public health community, when terms are used like abortion care, it really diminishes the credibility. So with that, thank you. Thank you, Mr. Chairman.
Ms. Meng, you're recognized. No, we're going to go. You were here when we started, I believe. And if not, take advantage of it.
Okay, thank
Go
you.
ahead. Pretend you were.
Thank you, Mr. Chairman, and Ranking Member Franco and DeLauro, and to our witnesses for being here. In June 1981, 5 cases of a mysterious illness appeared in Los Angeles, and that moment marked the beginning of the HIV epidemic in America. Since then, over 700,000 Americans have died from this illness, including 8,000 each year. But HIV/AIDS didn't start here, but we knew that protecting Americans and addressing the AIDS epidemic meant fighting the disease globally, and that's why PEPFAR is important. Since 2003, we have saved 26 million lives through PEPFAR and another 65 million through investments in worldwide HIV response programs like the Global Fund. We're actively helping to treat, you've heard the numbers, over 20 million people with life-saving medication, including pregnant women. We have prevented 7.8 million babies from being born with HIV. And as a mom, that last number means so much to me. Because of this program, millions of children have been able to grow up without worrying about treatment or passing HIV on to others. Meanwhile, PEPFAR's annual regular funding since 2009 has been flat. In fact, the cost of treating someone has dropped from $1,200 a year in 2003 to just $58 in 2023. And that sounds pretty efficient to me, Mr. Chairman. PEPFAR is a crown jewel, but this administration's illegal, unconstitutional, and chaotic attacks on USAID, our public servants, and the programs they support are jeopardizing decades of progress. Ms. Connor, I'm very worried about the impacts of the stop work order on ARVs. This is, as you know, medication that 20 million people receive that helps stop the spread of HIV. And each day of the foreign aid freeze, over 220,000 people, including 7,000 of them who are children, were blocked from receiving these. As you mentioned in your testimony, a study showed that 1 in 5 HIV-positive children who experienced treatment interruptions died. Interrupting ARV treatment risks creating drug-resistant HIV trains, correct? Can you talk a little bit about that?
Absolutely, and thank you for raising this question. You know, when I started working at EGPAF, I had to go around to members of Congress and tell them there were 2,000 children that were acquiring HIV every day, and that number is down to 300, which is still too many by any measure, but that just kind of speaks to the success. And a lot of that is because of the ability to put pregnant women on treatment. So I just want to thank you for raising that issue. You know, drug resistance and treatment failure is a really big problem, especially in the pediatric community. A lot of children who are exposed to HIV are exposed, again, through pregnancy, labor and delivery, and breastfeeding. And so if they do end up being HIV positive, often they are resistant to the drugs that their mother may have been taking. And so we have to be very vigilant on that. And that's why treatment disruptions in the adult and the pediatric community are so important to try to avoid, is that we do find that when people's treatment is disrupted, not only do they get drug resistance, but their virus tends to spike, right? So not only have they stopped treatment, they are actually, they get sick very fast, and that means that they're able to infect other people, and they won't even really understand or know that. So this is an area that we take really seriously, and as we're looking at sort of where the disruptions are, we are trying to make sure and work very closely with the ministries that at least where we can, that ARVs are being supplied, and again, hopefully at the levels that people can adhere. But we are starting to see some rationing of medications as well. Just because of the uncertainty, I want to be clear that uncertainty here is almost more dangerous than what's happening on the ground, is that ministries and partners are unable to plan ahead, unable to look at what's available and sort of redistribute resources. It's just everyone's a little bit frozen in place, and that has its own damaging impacts.
Thank you so much, and I'll pivot quickly to, if I still have time left, to my home state of New York. The administration's dismantling of USAID obviously will impact so many of the communities and districts that we all represent. Between 2022 and 2024, USAID contracts were responsible for over $12 billion in grants and funding to organizations and universities here in the U.S. In my home state, we received over $185 million during that period, money that went to disease research and treatment and programs to help reduce the cost of everyday goods like coffee. And now the administration has canceled many of them. One of the impacted groups is the International AIDS Vaccine Alliance, headquartered in New York City. They were developing a promising vaccine that was already in clinical trials, and the administration canceled their contract, resulting in the end of that clinical trial. You know, an American-led, taxpayer-funded HIV vaccine trial was actively underway, and if successful, could have helped prevent almost 32,000 Americans and 1.3 million people around the world from getting HIV each year. Ambassador, can you discuss the impact that an HIV vaccine and other injectables would have had on treatment costs and PEPFAR's sustainability?
Yeah, yes, thank you for the question. I'll do it quite quickly. The vaccine was, by the way, I used to be on the board of IAVI, so I want to make that clear. So I was involved in some of that planning. The new technologies that are available, there are long-acting injectable drugs that actually prevent infection. So like you would take malaria, anti-malaria drugs when you travel. This is the same. It's called pre-exposure prophylaxis. You take antiretrovirals to prevent getting infected in the same way you treat, just like you do with malaria. So a couple of companies have developed injectable products that you can have one injection every 3 or 6 months, and the 6-month one should be available, we hope, soon, by American technology and American companies. One injection every 3 to 6 months could prevent new infections, which is how we get to no more infections. And then the vaccine would add on to that as well. There are a couple of countries, the United Kingdom and the Netherlands, that are very close to achieving that. And the United States was getting close. The first Trump administration actually put the end of HIV as a top priority for them domestically. And it is possible, and these new technologies will make it possible. If you can give an injection once every 3 to 6 months and prevent new infections, there's a pill that does that as well that is being used. And it was starting to be used in Africa. So for the long term, one of the key parts of sustainability transition is get the new infections down. And a second part of that, and this is an unfortunate part, but it happens to all of us. If you do an actuarial analysis, there have been many people on therapy now for 20 years. So there have been estimates of the fact that they're going to start dying from natural causes, even if they retain their antiretroviral therapy. So if you reduce the number of new infections, you have an increase in death for natural causes, you get down to a very small number of people that will need treatment for the future. That's sustainability. But that requires planning. Countries are ready for that planning. I can't tell you, Africans want a transition. They are not looking for this to continue forever. They want a transition, but they want a transition that they can manage because it shifts responsibility to them, and they want the private sector very much at the table. They want all the things we've been talking about. So you have ready partners to go with, but these technologies are hugely important to achieve that ultimate goal. And we can actually have an AIDS-free generation because of those new technologies, including the vaccine and including the long-acting injectable products.
Thank you. Mr. Alford, you're recognized, sir.
Well, thank you, Chairman Diaz-Bayart and Ranking Member Frankel for holding this. I think this is a very important subcommittee hearing that we're having today. Thank you for being here. PEPFAR has saved the lives of millions of innocent people and strengthened global health for decades now. Dr. Dybel, I'd like to thank you for your work in establishing this program during the Bush administration. Your work has saved millions of lives. But as we are doing today, we are confronting the fact that this last administration has somewhat turned this life-saving program into something it should not be. Using taxpayer dollars to fund abortion is abhorrent. I know the number is 21. It would be abhorrent if we used taxpayer dollars just for one single abortion. And I know you've spelled out how this happened with the nurses in Mozambique and the money that was returned that was supposedly used for this, that was used for this. I want to focus on how we prevent that from happening again. So, Ambassador First off, does the use of taxpayer funds for abortions, what does that do to the public trust in this program?
Certainly for a lot of Americans, that would undermine the trust in the program, and that's something that needs to be rebuilt. And there's no question about the need to rebuild that. And any violation of any law of the United States is something the American people should be concerned about.
If we move forward with funding for PEPFAR, what guarantees can you make that American taxpayer dollars will never be spent in this program again for another abortion?
It's hard for me to guarantee that because I'm no longer in the administration. However, what can be done, as often happens with other violations of law, are a couple of the things that I mentioned. One is the training, so that everyone is aware of what the law is, which unfortunately these nurses were not. Secondly is to require them to actually sign attestations that they are aware of that. And third is to do regular reviews, which is the most powerful thing you can do. But you need people and money for that. So there are a few countries, not many, but there are a few countries that have legalized abortion where PEPFAR operates. That's where you really need to do your focus on those pieces, and you need to go out to the field, and you need to do program reviews. And you need to do them regularly, but you also need to do them randomly, because that will make people aware that if they're caught, there's going to be a penalty and a cost. So those are the tools that can be and must be used to ensure that this does not happen again.
Let's talk about the transition plan. Ms. Connors, are you in agreement that this should have a transition to private entities, faith-based organizations in other countries?
I think we view this as a really strong opportunity to start the sustainability and transition process. I think that Ambassador Dybel and I may disagree on the pace of that. Obviously we work at the project level. We have a lot of experience with transitioning projects to local ownership, to governments over time. On average, it takes us a 4 to 5 year period of time to really walk through, identify what we're going to transition, how we're going to transition.
I have 2 minutes left. So you're in agreement it should be transition. It's just a time difference that you have with the ambassador.
And the planning process. The well-planned part of it is very important.
Ambassador, what is your time frame for a transition?
It's difficult for me to have a time frame because I'm not operating, but I do work very closely with many African leaders. They want to work to transition as quickly as possible. And I do think
5 years, 10 years?
Some countries we can start the reductions now. It's not as if you do fund completely and then you just transition. It's a constant reduction.
What guarantee do you have that if we transition out, that China won't transition in, filling in the void that we leave behind?
Well, the thing is, if you do the transitions right, there is no void left for them to fill, because you would transition to local organizations, government, non-government, faith, community-based organizations doing the work. And we've seen this happen. We know it can happen. We already have 60% of domestic resources going to fund the programs. The issue is timing and planning, and it's going to be country specific. So there are some countries that have relatively large resources. For example, I've talked with the people in South Africa. They could transition probably in a year or less, but they need to know where to put the money. There are other countries in similar position. There are Nigeria, Tanzania, Kenya, Namibia, Botswana, countries that actually have decent incomes, but they would, the risk is that if we go too quickly, that void will be there. If we plan with them, bring in the private sector to invest as well, it's a gain for all of us. There will be no void, and we will be the heroes. We will have successful transition versus failed transition. It's the failed transitions that will lead to that void and opportunity.
Thank you. I yield back.
Ms. Torres, thank you for your patience, and you are recognized.
Thank you, Chairman. Thank you for holding this meeting with such an important organization. But I have to say that I am extremely disappointed that we are continuing to hold briefings here in the U.S. Capitol where people have no access unless they are escorted by a staff member while conducting a tour of the Capitol. You know, so much has happened. Where is the transparency and accountability? Trump has completely destroyed our American brand. He and Elon Musk are isolating us, and you know it, Mr. Chairman, it will not end well. In just 11 weeks, members, 11 weeks in office, Trump has taken $11 trillion out of our economy. Yet here we are, talking about a $4,000 expenditure, illegal expenditure that was paid back. So you are so concerned about $4,000, but head in the sand of the $11 trillion that has been taken, stolen out of the pockets of the retirement accounts of all of our constituents. This is insanity. Mr. Chairman, I'm going to request unanimous consent to submit for the record an original undoctored DOJ webpage thanking USAID for critical support capturing and charging the MS-13 gang leaders, because the truth is USAID has done a great job for the American people, keeping us safe, ensuring that the people that want to come and do us harm, working with other governments like Mexico, don't get to our southern border. But yet, when the Department of Justice recently arrested
But you're-
three of those top MS-13 gang leaders in the world on terrorism charges and publicly thanked USAID as providing critical support for the mission, a few weeks ago, the Trump administration, Mr. Chairman, shamelessly tried to erase that action by deleting this document from the DOJ website. So I want us to put it to the record so that we have some transparency and accountability about the good work that is being done by USAID.
So you're asking to submit that on the record. We'll do that
Yes.
without objection.
Thank you. Congress can fix this demise that is happening. And why have we not held a USAID hearing as of yet? Why have so many members forgotten their oath to uphold and defend our Constitution? Breaking the law should be a concern for everyone, regardless if you have an R or a D after your name. In this administration's blatant illegal acts and the ignoring of court orders should be at the top of our list, the law and order party that we say that we are. So here we are, Ms. Connor. PEPFAR is another example of successful programs that help both America and the world that are now under attack. And it is estimated that over 30,000 adult deaths and over 3,000 child deaths have occurred that are associated with this administration's foreign aid funding freeze and discontinuation of the PEPFAR programs. Can you tell us, as an HIV practitioner for many years, can you share with the committee what your assessment is of the orphans and vulnerable children programs and what it means for children now that these programs have been completely shut down?
Thank you for that question. You know, I think part of the PEPFAR program has always included the desire to make sure that children grow up in stable and safe homes, free of exploitation and violence. And that's been since the beginning of the epidemic, as Ambassador Dybel mentioned, when there was a real crisis. That still continues today. And in fact, what OVC really does is it really strengthens the community and the caregivers around a child so that they can thrive. We see this a lot in our work. You know, we are largely a clinical organization, but we rely on our OVC partners and OVC programming to supplement what we can't do in that clinical setting. There was one of our community health workers recently told us about a story is that he was sitting with a recently diagnosed 5-year-old girl. She was diagnosed HIV positive and TB positive. So gravely ill 5-year-old from a poor family. Mother doesn't have money, father doesn't have money. In those situations, the first thing you do is reach out to your OVC providers. OVC providers provide nutritional support, economic support, caregiver support. They're the ones who really go to that household level, that community level, and say, how can we make sure this children thrives? And when our community health worker contacted that OVC program, they said, I'm sorry, we've been terminated. There's nothing we can do. And so that's the level that we're facing. I mean, that's a real patient experience. But we're seeing in other places too. Another health worker said there's a 10-year-old who'd been struggling to stay on medicine because of food. And there had been food support through OVC, and now that wasn't available. So I think it's a real struggle because OVC was sort of characterized as non-life-saving, that it has not been prioritized in the waiver process. That doesn't mean it may not be prioritized after the review is done, but we really are concerned about the hole that we're seeing there. And one last thing, there is a Lancet article that came out today that really puts a finer light on what's happening around children and orphanhood, and they actually predict that there could be millions and millions more orphans if PEPFAR funding retracts too far, if it's seceded or retracted too far.
Thank you for the extra minute. I'm going to yield back. Thank you.
Thank you. I think this has been a very helpful hearing. Let me, again, first go to, because people have to move on in other meetings, and I think everybody's been very good. I think the witnesses have been extraordinary. Let me recognize the ranking member for if you have any further questions
ma'am.
or
Thank
closing.
you.
If you can just do your
I'm
closing
gonna
as
do
well.
my
There you
closing
go.
with a question. Closing with a question. First of all, I want to thank our witnesses again. You are so, obviously, so competent and professional. It's just been an absolute pleasure to have you here today. And I want to thank Mr. Chair for bringing this hearing and bringing these witnesses. Exceptional. And I just, I don't mean I don't like to exaggerate or be trite, but I do think that what we listened to today is earth-shattering. It really is. Because there are millions of people whose lives are at stake. We're on the real possibility of losing opportunities with Africa, the fastest growing population in the world, opportunities in regards to security and trade. But we also heard that we are on the brink of finding a way to keep people from ever having their HIV come back with a simple injection every few months. That's just absolutely amazing. But here's what you both said. I think, and that's why I want to end with before I end with the question, I have to take one more pot shot, okay?
Go.
Just one more. He understands me well. Listen, I just want to say this. A violation of the Helms Amendment, which affected 21 patients, I'm not going to minimize your shock. I wouldn't bring smelling salts with me in the future, but it's not an excuse to put 20 million lives in jeopardy right now. It's not an excuse. We're going to move on, and we're going to try to do this the right way. But I think what both of you have said, as I've heard you, is this, and you can correct me. Let's not shatter, let's not lose what we have had with PEPFAR. Let's find a way to transition to where other health systems in other countries can take over, where this can be a sustainable program, which will mean really the United States, being our taxpayers, to be able to use their money in different ways. But maybe what we're going to be in other ways to stop other calamities. This is my last question that I want to make sure that I could, from both of you. Do you both agree that it is very important that we do not let Humpty Dumpty on the ground all shattered before we try to make this transition, that we have to make sure there's prevention, that the whole comprehensive PEPFAR piece is looked at before we're able to even transition? I think that I'm trying to say that as diplomatically as I can, and that does mean that other agencies, that we have to make sure the CDC, USAID, well, we don't have USAID, but the pieces of USAID, the Defense Department, the Global Fund, that those pieces are working too. Did I make my question clear here? In my,
I think so. I'm
Okay.
happy to go first. You know, I would hope, Ranking Member Frankel, that your taxpayers and your constituents were proud of PEPFAR. You know, I would hope that they would see the work that's been done and really consider it an American success story, not just an African success story. You know, it has been very personal, I think, to many Americans who are knowledgeable about the program, that we've been able to save so many millions of lives. And one of the things I've reflected on is sort of, you know, in the polling that's done that shows that Americans really like this, you know, I think it resonates because it's some of the values that they see in their own communities, that we don't let families suffer unnecessarily, that Americans are uniquely built to tackle big problems. And this is a big problem that Americans have tackled, and I think they should be really proud of that. So as we look ahead, we shouldn't forget those values and why that's so important. And again, I think Ambassador Dybel and I are aligned in many ways that, you know, we do need to think of a transition and sustainability plan, but first we have to look at the capacities that are there, you know, and really reassess what are those capacities we have, what are the strengths of American ingenuity and American companies that we really want to bring to bear. I think we have to look at sort of the goals we still want to achieve. PEPFAR's mission has been very clear. It has been meant to save lives, reduce infections, put people on treatment, and stop people from dying, especially children dying of AIDS. Are those still the goals? And then you can look at a sustainability plan on a country by country basis and say, here's where we can move, here are the roles and responsibilities we're going to share, here are the roles and responsibilities that have moved on to you, here's where private sector can leverage this work and really help us bring those innovations like digital health, like AI, like those new prevention technologies to bear. It's a longer conversation. I don't think it's just a U.S. policy talking to the national government's discussion. I do think you need all the partners at the table to really go through it and assign those roles and really think to the future. Because I don't think we want to arbitrarily pick a timeline and, as you said, sort of waste all the infrastructure, waste all the work we've done because we decided that we wanted to be out by a certain day, and all those reasons we were doing this work no longer mattered.
Mr. Dybel.
Thank you to this subcommittee and to the chair and ranking member and to the whole committee for holding this hearing, first of all, because there are so many other things to do, and for your constant bipartisan support. I do think you framed it exactly right. We have the opportunity to have not only the legacy of the last 20 years, but a tremendous diplomatic, national security, and economic success. So we do want to transition from financing over time, but we want to transition to stronger economic, national security, diplomatic partners. And that we can do. It will be different country by country. There are some countries that will require long-term support because of their socioeconomic status. Others can move more rapidly. And I would like to emphasize again that if we move too quickly, the groups most likely to be impacted are faith and community-based organizations because governments don't actually have mechanisms to fund them. But we know, because we've done it in the past, we can support them to create those mechanisms. So we have an opportunity before us, similar to 25 years ago when PEPFAR was started. We have an opportunity to have a massive win for the United States on all levels by having successful transitions, by working with the countries. And I can guarantee you that the countries want that transition, but it has to be done in a staged, structured way rather than a chaotic, rapid retreat.
Thank you. And I'm not asking another question, but I'm just waiting for the. Again, thank you both. Mr. Chair, I just have a request, if I don't know what to call this, from this committee. This is, you know, a lot of people, I mean, I think what we heard today is so important. I hope that we can find some consensus to deliver a message. I'm not a political message. We have got to keep PEPFAR stabilized, keep the component parts together now so that we can do this transition, because you cannot transition from nothing or from a mess. It'll cost a lot more money. So I hope that we can find some way to deliver this message that I think I've gotten from these two witnesses today in a very non-political way, and then move towards the transition that we've heard about. And with that, I yield back.
Thank you very much. Let me again thank both of you. I think this was very helpful. It's amazing what you can get done when we actually have folks who understand what they're doing and who understand the subject matter, and without the, you know, I'm not, because I love activism, but it's nice to be able to do this here in a forum where we've been able to talk about it. So it's clear we have a lot of work to do as we put the fiscal year 26 bill together, and I think we've heard some great recommendations and some great ideas today. It is clear that we have to increase accountability, ensure transparency, and we can always do more and better, and we always have to strive to do more and better in that sense. And so I think today's been very helpful. With that, Ambassador Diboll and Ms. Connor, thank you again for your time. One thing that we never get back, right, is our time. And so with that, this concludes today's hearing. The Subcommittee on National Security, Department of State, and related programs stands adjourned. Thank you.